Hi there, this is Pablo, this is my dog, and we're just going to give you a short demonstration on what we need you to do to get the best out of your video consultation with us. So we may ask you to just look at your dog, point the camera at your dog from a distance so that we can get an idea of an overview, to look at eyes, ears, the way they are standing, just a general overview. And then when we go into more detail, we're going to ask you really to start from the nose, and then we'll go to the tail bit by bit and examine bits of his body. So one of the first things we're going to ask you to do is to look at gum colour. So we're going to ask you to lift the lip, and as you can see, Pablo's lovely and pink, and then we'll ask you to press the gum, and as you can see, it remains pink at all times. It doesn't go white, it doesn't stay white for any length of time, which is completely normal, but we'll ask you to do this for us. And we can also get a little look at teeth at the same time, and as you can see, poor Pablo is missing quite a few from having had dental disease historically. We then may ask you to have a little feel under the chin, just to see if you can feel for any lumps or bumps, particularly under the base of the jaw bones either side. And then we would like you to look in ears. So when we look at the ears, we lift the pinner, the outside of the ear, and we'll ask you to hold it open if you can, just gently, and then you can have a good look in. If you come around the corner, you can see down. Yep. Okay, so that's one ear. We will do the same with the other ear, and we'll have a little look to see if there's any signs of ear disease. And then we'll move further back. So we'll ask you to give your dog a little bit of a general stroke over to see if you can feel any lumps or bumps or anything that you're concerned about. We may ask you to look at feet and nails, and we can look, if we are worried about pads, we can get quite good close-ups of pads to look for things that may or may not worry us, depending on what your concern is. One of the big things to do that would be a good thing to practice with your dog now would be to try to feel for the heart or the pulse, so that we can get an idea of heart rate. So either on the left side or the right side of your dog's chest, usually the left side, but because Pablo's a Saluki, I can feel it either side. You just go behind the elbow and you put your hand on their chest, and you should be able to feel the heart beating, and you could count it over a minute, okay? And in fact, in Pablo, because again of his breed, you potentially could see, you may be able to see his heart beating from where you are, okay? You can also feel for pulses on the inside of the leg, the inside of the thigh. So if you put your hand parallel into the thigh and feel about midway up from between the knee and the hip, you should also be able to feel a pulse there with your fingertips. Okay, so it's a good one to just try and practice, so that if and when we need you to do that, you're a bit more confident in doing it. Then we come round to the back end, and we may just ask you again to put your hands down the legs to feel for any lumps or bumps. We'll ask you to lift the tail so we can have a look and check that the bottom's clean and that there's nothing odd going on there. And that's it, that's what we would like you to do.